Hi everybody, we're going to just touch on some of the main topics in your ATI leadership book, and this corresponds with chapter 1, which is talking about managing client care. So when we're talking about leaders in nursing, know that there are 3 different types of leadership styles. You have your authoritative, democratic, and laissez-faire. Those that are authoritative obviously are those that are basically going to tell you what you're going to do. They will make the decisions for the groups. They typically will not ask for input from the group. This is typically good in times of crisis. So say if you're in a code, typically you have one individual that is running the code and they basically assign tasks, and really you cannot argue with those assignments. A democratic leadership style, they will include the group when making decisions, motivated through supporting staff achievements. This is typically best in most settings, versus your laissez-faire, where you have somebody that really doesn't make a whole lot of decisions, does little planning. Communication occurs kind of in a up and down the chain and between groups, but a lot of times this is not very effective within groups that need some sort of leadership. This could be best for people who are autonomous and can kind of work on their own. But typically I would say in a nursing setting, healthcare setting, democratic is best because it has more to do with cooperation and collaboration. And like I said, in situations where, say, like a code, you do need to have somebody kind of take charge. Making nursing care decisions. So far, while you've been in nursing school, prioritization has probably been said over and over again. Make sure, and this will help a lot when you're answering questions, NCLEX style questions, and you can see here by the list that I provided how it can be confusing sometimes for students, that you have to perhaps apply different principles, whether it's the nursing process, your ABCs, acute versus chronic, actual versus potential problems. Don't always assume. Look at trends versus transient findings, and sometimes you have to apply Maslow's hierarchy of needs. And so this diagram here I find to be one of the best ones, because I think sometimes students have a difficult time with this pyramid, but typically what we want to satisfy with most of our patients are these basic needs, and it's not written down here, but also along with the physiological needs can also incorporate pain as well. So if a patient's in pain, addressing those pain issues would be part of that foundation. Delegation is something that is also very important in nursing care. And when we talk about licensed personnel, that's going to be your registered nurse or your licensed practical nurse. Anytime you see APs, that stands for assistive personnel, they typically are trained. That can fall underneath with CNAs, CMAs, PCTs, dialysis techs, phlebotomists, and if you see NAP, that is specifically a nursing assistive personnel. One way that I try to help students kind of differentiate the roles, I sometimes think of APs as, say, a volunteer who can do vital signs. So it's vital signs for a stable patient. So if you have, say, a brother or sister who is not a registered nurse, but you teach them how to do vital signs, and your mother is sick, well, they can take care of mom at home, monitor vital signs as long as she is stable, and that is a key word, especially with a lot of APs, that they have to be a stable patient. obviously if they're not stable, you, the nurse, should do those assessments, but they can help do most things, assisting with ADLs and things of that sort. So when you're looking at delegation, the tasks you have to look at, whether if the outcome is predictable, if there's any potential for harm, what the complexity of care is, any need for problem solving, and if the level of interaction with the client is accurate for whoever's doing the task. So there is actually 5 rights of delegation. Is it the right task, the right circumstances, the right person, the right direction and communication, and the right supervision and evaluation. So please make sure you review in Chapter 1 a little bit more about that. So some of the things that can be delegated to a practical nurse or a licensed practical nurse, they can monitor findings that you as a registered nurse has already done. They can reinforce teaching, so the registered nurse has to do the initial teaching. A LPN can do trach care, they can do suctioning, they can check NG2 patency, they can administer enteral feedings, they can put in a urinary catheter, and they can administer medications excluding IV meds. So IV push, IV piggybacks, things of that sort that would need to be done by the registered nurse. Things that be delegated to an AP, again, kind of like I was saying before, think of a volunteer that has little additional skills where they can do vital signs. So you can help with anything from ADLs to feeding, as long as there's no swallow precautions, to vital signs, as you see here, for stable clients, and that's always going to be key. So other things like that. If some of you remember, I think back in one of our courses, you had a question about taking out the trash. That is not an AP's responsibility. That would be environmental services. So know what the task is. Staff issues and needs. When we're talking about leadership, does staff need education? If there's something going on, you always have to identify what the need is, do an analysis, research what resources are available, plan the education, implement it, and evaluate whether it's been effective. If there is conflict within staff, the stages of conflict, typically you have the latent phase where there is a potential for a problem. Then there is the perceived, where there is an acknowledged potential conflict may or may not actually exist. Felt is basically there is a conflict going on, the manifestation of it, and then obviously the aftermath. Staff discipline, this is pretty common in most settings. It's usually verbal. It needs to be done either immediately or, depending on the situation, it needs to be conducted within 24 hours. If, let's say, a staff member is sent home because they have come in under the influence, obviously you can have a discussion with somebody who's under the influence, so at least needs to be conducted within 24 hours. And obviously if you send somebody home, you have to make sure they get home carefully. Then typically it's written. Then there is possibly sometimes suspension with or without pay and lead to termination. And it all really kind of depends on what the infraction is. Staff grievances, you have to go through the proper chain of command. That is something we always talk to students about. It leads to a formal hearing if there's no resolution at the lower level, and sometimes professional mediation if no resolution happens at the formal hearing. So that just kind of touched base on some of the things from Chapter 1 in your ATI book. Those are just kind of the highlights I wanted to hit. And if you have any questions, please feel free to post on your appropriate discussion board.